In this session, we will be discussing about the front of forearm. So this first introduction is the forearm, and this forearm, just like arm, is divided into flexor compartment and the extensor compartment. The forearm is also divided into flexor and extensor compartment. The flexor compartment is also called as the anterior compartment, and the extensor compartment is also called as the posterior compartment of forearm. So first we will discuss about the flexor compartment of the forearm or the front of forearm. So within this, first about we will discuss what is the skin, then superficial fascia, then deep fascia. There is no such specific features about these three, but what are the muscles that are present deep inside these three layers is they are divided into superficial and deep. So what are the superficial muscles are? Pronator Theories, the lateralmost muscle. Then is Flexor Carpi Radialis. Then Palmaris Longus, Flexor Digitorum Superficialis, and Flexor Carpi Ulnaris. So these are all the superficial muscles from the lateral towards the medial side. Some people consider the Flexor Digitorum Superficialis as intermediate compartment also, but either if you better to compare it with the superficial compartment itself. Now coming to deep compartment, or the deeply placed muscles are 3 in number. In the upper part on the lateral side is the Flexor Pollicis Longus, Flexor Hallucis Longus, and in the medial side it will be Flexor Digitorum Longus. And in the lower part of the forearm there is a quadrilateral shaped structure called as Pronator Quadratus. So these are all the muscles of both the superficial and the deep. We will go into details of origin, insertion, what is the nerve supply, and what are the actions. So this is what we will be discussing about. What the basic difference between the arm and the forearm? Arm, we had already said, whenever they want to show their muscles build up, then automatically they will show the biceps, right, and also the triceps. This will be more looking part. So in order to the thickness of the muscle or the number of muscle fibers will be more in case of the arm muscles, but the total number of muscles are less in number. But exactly contradictory in case of forearm, where the number of muscles are more, but its muscle fibers are less. That's the only basic difference. Okay. Once again, I'm repeating. In the arm, the number of muscles are less, but the muscle fibers of each muscle is more in number. Whereas in case of forearm, the number of muscles are more, but each muscle number of muscle fibers is less when compared to that of arm. That is why the reason whenever the body build-up has to be shown, they will be showing more of the arm part, the biceps or the triceps, like that. But forearm also they will be light bulkier, but not as much as in case of arm. Okay, so let's discuss into the forearm part. In the forearm, if you do the cross section, let's see, this is the forearm, and this is the anterior end, this is the posterior end. And in the cross section of forearm, we have 2 bones. The medial bone is called as ulna, and the lateral bone is called as the radius. And deep inside the skin, we have the deep fascia, just like in case of arm. Now this deep fascia also extends towards the bone that will divide the forearm into anterior and posterior compartment. But what about between the ulna and the radius is there is a specialized membrane called as interosseous membrane. So this makes the anterior one as anterior compartment and posterior one as posterior compartment of forearm. Okay, so anterior and posterior compartments are basically divided by the extensions of deep fascia, and in between the 2 bones the membrane is called as interosseous membrane. Okay, so that's about these compartments. So first we will discuss the details of anterior compartment, then we will be discussing about the details of posterior compartment. Okay, so let's see first as anterior compartment. So in the anterior compartment, what is present is there are 2 groups of muscles. One is the superficial group, the other is the deep group. Superficial group muscles and also the deep group muscles. So what are the superficial group muscles it consists of in the anterior compartment is the first muscle is Pronator Theories. After that it is the Flexor Carpi Radialis. Then is Palmaris Longus. Then is Flexor Carpi Ulnaris, which is present towards the ulnar side. There is one more muscle that is called as Flexor Digitorum. Digitorum Superficialis. That means which supplies to the digits and is present on the superficial side. That's why it's called as Digitorum Superficialis. Okay. In some books, they will consider Flexor Digitorum Superficialis as an intermediate group, but in the Gray's Anatomy, it was given as a superficial group only. So go with that flow only. Whereas in the deep group, there are three more muscles are present. The first muscle is Flexor Digitorum. It is present deep. So the deep in anatomical terms, it is called as Profundus. Flexor Digitorum Profundus. And finally, one more deep muscle, that is Pronator Quadratus. So these are the groups of muscles in the superficial and the deep part. So let's discuss one by one. After completing this group of muscles, then we will enter into the vessels and finally the nerves. Okay, this is the sequence that we will go. So first, in the anterior compartment, we are discussing about the muscles. Let's complete the muscles first. First, Pronator Theories. I had already drawn a diagram so as to make the time sufficient for us. Usually, majority of the flexors, that means the anterior compartment muscles consists of flexors, right? So majority of these muscles are, the common origin is the medial epicondyle of humerus. Medial epicondyle of humerus. But there are some minute variations. How the minute variations we will see here. So first one we will be discussing is Pronator Theories. So in the Pronator Theories, where will be the origin? It will be the medial epicondyle of the humerus, and a part of the slip will be originating from the coronoid process also. From there, these muscles will be going and then inserting over the lateral convexity of radius. So the extension of the muscle will be like this. So there are two slips of origin. One is from the medial epicondyle, the other is from the coronoid process. There is a gap between these two, and through that gap there is one important nerve will be passing, that is called as median nerve. Please remember this point, very important, because there are three different major nerves. While entering into the forearm, it will pass through three different muscles. So here what I am saying is the median nerve will be passing to the forearm through the two heads of Pronator Theories. Okay, so first write down the origin. The origin is medial epicondyle. Medial epicondyle of the humerus. And also another one from the coronoid process of ulna. And insertion is the lateral convexity of radius. This is for the humerus and this is for ulna. And in between these humeral and ulnar head, which nerve will be passing? It is the median nerve pass in between. Very important. Median nerve passes in between. And what is the nerve supply? The nerve supply is by the median nerve itself. And what will be the action? The name itself is suggesting Pronator Theories. So it helps in pronation and part of the flexion at the elbow joint. Pronation and supination occurs at the radio-ulnar joints. So radio-ulnar joints as pronations and a slight flexion, very poor flexion, but it is present in the elbow joint. This is what regarding the first group of superficial muscle, that is the Pronator Theories. So let's go for the second one. The second muscle is Flexor Carpi Radialis, shortly known as FCR. Okay. In the flexor carpi radialis, I already said the common origin for the flexors is medial epicondyle. So I'm highlighting again the medial epicondyle of the humerus. From there, this muscle will be coming down, and then its tendons divides into two slips to insert over the second metacarpal and also the third metacarpal bases. So how the muscle extension will be like this. It will be coming down all the way here and suddenly it divides into two tendons. One tendon will be going to the base of second metacarpal, the other will be going to the base of third metacarpal. So origin, medial epicondyle, humerus. What is the insertion? Second, third metacarpal's base. Okay, please understand the difference. Okay, where exactly the insertions are going on. And now supply will be by the median nerve again. And action is flexion, both at the level of elbow joint because it is crossing the elbow joint in the front side, and it also crossing the wrist joint, so it causes the flexion even at the wrist joint. That's the actions of flexor carpi radialis, the second muscle in the superficial compartment. So the next muscle in the superficial part that we will be discussing is Palmaris longus. Palmaris longus. This one also is having the same origin, that is the medial epicondyle of the humerus. From there, it will be going down superficial to the top flexor retinaculum. Left flexor retinaculum is somewhere here. And superficial to it, the tendon will be passing. Please remember. And what is this flexor retinaculum? We will be discussing in the hand initial parts. Okay, it's actually a thickened deep fascia at the level of wrist joint. Now this over superficial to it or over it, the tendon will be passing and enters into the palm, where it expands as an aponeurosis called as palmar aponeurosis. Okay, palmar aponeurosis, which is actually a modification of deep fascia again within the hand. So the extension can be from medial epicondyle. From there it will be coming down all the way superficial to the top flexor retinaculum. The only tendon which is going superficial to it, superficial to the flexor retinaculum, is the Palmaris longus. From there it will be dividing as a triangle shaped aponeurosis like this, that is called as palmar aponeurosis. So origin, medial epicondyle of humerus. And where is the insertion? It will be inserting as palmar aponeurosis. Where? Bypassing superficial to flexor retinaculum. That's the important thing. Superficial to flexor retinaculum. And what is flexor retinaculum? Is actually thickened deep fascia at the level of wrist joint. Next, what is the nerve supply? The nerve supply is by again the median nerve. And the actions is it causes a weak flexion even at the elbow joint and also at the level of wrist joint. But the major one is to hold the to make the grip at the level of hand. So flexion at the level of elbow joint, at the level of wrist joint, and also make hand grip. These are the actions of Palmaris longus. That's about the third muscle in the superficial part. Next, the fourth muscle in the superficial compartment and the superficial part is flexor carpi ulnaris. Just like the other muscles, the common origin for the flexors is the medial epicondyle. Here also it will be originating from the medial epicondyle. From there, it will be extending. It's not only in the medial epicondyle, but a part of it will be originating from the medial part of the olecranon process. So it will be two origins. From there, it will be going down and insert on the base of fifth metacarpal. Okay, so extensions will be, this is one head and this is another head. Both the heads fuse and then comes and insert here. So where is the origin? One is the medial epicondyle of the humerus, and the second one is the medial part of olecranon process. And olecranon process is a part of ulna. This is about the origin, and where is the insertion is at the level of base of fifth metacarpal. Fifth metacarpal. It is fifth. Okay. And what is the nerve supply? The nerve supply for flexor carpi ulnaris is ulnar nerve. And the action is it causes, as it is crossing the elbow joint in the front side and also the wrist joint in the front side, so it causes flexion at the level of elbow joint and also wrist joint. Both the joints it causes the flexion, and there will be, due to some contraction, the hand will be deviated slightly towards the medial side. That is called as the ulnar deviation or medial deviation at the level of wrist joint. Medial or ulnar deviation at the level of wrist joint. This is about the flexor carpi ulnaris. So here is also having two heads. So in between these two heads, one more nerve will be passing, that is called as ulnar nerve. So in between these two heads, ulnar nerve passes between the two heads. So in between the two heads of pronator there is a median nerve, and in between the two heads of flexor carpi ulnaris, ulnar nerve will be passing. Then what about the radial nerve? We will be discussing in the further sections. So that's about the fourth muscle in the superficial one. And finally the fifth muscle in the superficial part is flexor digitorum superficialis. Digitorum superficialis. As it supplies digits and is present on the superficial side, that's why it's called as flexor digitorum superficialis. It has a vast extension of its origin. One is at the level of medial epicondyle of the humerus. Second is the medial ulnar collateral ligament, which is a part of the elbow joint, and it will be originating from the olecranon and the coronoid process also. And the same will be extending towards the anterior part of tibial tuberosity and the oblique line which is continued. This is what regarding the origin. And what about the insertion is, it divides actually into four tendons, and these four tendons will be dividing as two sleeves which will be attaching to the sides of middle phalanges. So this is the second tendon which will be dividing and then attaching to the top sides of middle phalanges. Sides of middle phalanges. Here also dividing into two sleeves which will be attaching sides of middle phalanges. And this will be the extension of this muscle. Flexor digitorum superficialis. So where is the origin? First one is the medial epicondyle humerus. The second one is the medial or ulnar collateral ligament. Part of the fibers will be coming there. Then medial part of coronoid and olecranon. Then oblique line from the radial tuberosity. Oblique line from the radial tuberosity on the radius. Okay, this is the origin for that of the flexor digitorum superficialis. And where is the insertion? They are dividing into four tendons, and each tendon will be going four tendons for medial four fingers. Medial four fingers, and each tendon for the medial four fingers, each finger it will be dividing into two sleeves, and the two sleeves will be attaching to the sides of the middle phalanx. Sides of the middle phalanges it will be attached. And what is the nerve supply for flexor digitorum superficialis? Again by the median nerve. And action, it causes flexion as it is crossing the elbow joint in the front side, so elbow joint, and crossing the wrist joint on the front side, so wrist joint, and even it is crossing the metacarpophalangeal joints and proximal interphalangeal joints. Metacarpophalangeal joints and proximal interphalangeal joints it is crossing. So it also causes the flexion at these levels. That's about the flexor digitorum superficialis. As it has a vast extension, so it is also having its vast functions. Okay. So these 5 muscles are present in the superficial compartment. Next we will be discussing about what are the muscles that are present in the deep compartment or the deep part of anterior compartment of forearm. As a superficial group of muscles in the anterior compartment of forearm is completed, now we will be shifting to the deep muscles which are present in the anterior compartment only. So the first muscle we will be discussing in the deep part is abductor pollicis longus. Abductor pollicis longus. Pollicis is means for the thumb. So which goes to the thumb is one. And where it gets originated is, before going into the origin, first you have to understand what is meant by interosseous membrane. Interosseous membrane is actually in between the two bones there is a membrane. That's why it's called as the interosseous membrane. That means between the radius and the ulna. And what is the direction? That is the important thing you remember. That the direction is from the radius towards the ulna in a downwards medial direction. This is what the interosseous membrane fibers are present. And now coming to the origin of abductor pollicis longus, we had said that this is the oblique line, right? Below that oblique line is the origin of abductor pollicis longus with the adjacent interosseous membrane. So this entire part is the origin. And where the insertion is, it inserts into the base of a distal phalanx on the anterior side. So the extensions will be like this. It will be abductor pollicis longus. So origin is from the anterior surface of radius and the anterior surface of radius along with the adjacent interosseous membrane. Not the entire, only the adjacent interosseous membrane towards the radius. And where the insertion is, it is towards the base of the distal phalanx. Base of distal phalanx for the first finger. The first finger. And what is the nerve supply is again by the median nerve. And the action is it causes the abduction of the first thumb, as the first finger or the thumb we can say, at the level of metacarpophalangeal joint. That's the major function, and even it causes the flexion at the level of wrist joint as it is crossing the wrist joint on the anterior side. That's about these abductor pollicis longus, the first deep muscle in the anterior compartment. The second one is flexor digitorum profundus. Previously we had discussed flexor digitorum superficialis, as it is going to the digits and is present superficially, so it is called as flexor digitorum superficialis. Now it is also going to digits but present deeply, that's why digitorum profundus. So profundus meaning is actually exactly it is present deep inside. That's what the profundus mean. So where is this origin will be? First draw the interosseous membrane. It is downwards medially from the radius towards the ulna. This is what the fibers. And the origin is the anterior part of the ulna along with the adjacent interosseous membrane. This is what regarding the origin of flexor digitorum profundus. And this also will divide as 4 tendons for the medial 4 fingers. And where these tendons will be going to insert is, these tendons will be going continuously and pass between the 2 slips of flexor digitorum superficialis. See, just what is the slips that we had discussed in flexor digitorum superficialis is, each tendon will be going and then divides to attach the sides of middle phalanx. So it forming a tunnel between the middle phalanx and the 2 slips of the tendon, and through the tunnel this tendon will be passing. That is the flexor digitorum profundus. And then insert over the base of distal phalanx. Okay, so that's what the extension is. So it's attaching to the base of distal phalanx, and this is the extension of that muscle. So origin is anterior surface of ulna plus adjacent interosseous membrane. That's the origin. Next, what is an insertion is base of distal phalanx. Base of distal phalanx for medial forefingers. Medial forefingers. Okay, by 4 tendons. Medial forefingers, 4 tendons, and all are inserting to the base of the distal phalanx. Next, action. Before that, nerve supply. The nerve supply is for the flexor digitorum profundus is 2 things. The lateral part is supplied by the median nerve, and the medial part is supplied by ulnar nerve. As 2 motor nerves are supplying to a single muscle, so this is one of the hybrid muscle. It is a hybrid muscle. And what is the action? Action, as it is crossing the wrist joint on the front side, and even it is crossing the metacarpophalangeal joints, proximal interphalangeal joints, and also the distal interphalangeal joints on the anterior side. So at all these levels it causes a flexion. So flexion at the level of wrist joint, metacarpophalangeal joints, proximal interphalangeal joints, and distal interphalangeal joints. At all these joints it crosses on the anterior side. Okay, so that's about these flexor digitorum profundus. And finally, the last deep muscle, that is called as Pronator Quadratus. As a quadrilateral shaped muscle, so it is called as quadratus, and it helps in pronation. So where is the origin, where is the insertion? The origin is the lower anterior surface of the ulna, and the insertion is the lower anterior surface of the radius. So this is what the extension of this Pronator Quadratus in a quadrilateral shape. Anterior lower surface ulna is the origin, and insertion is anterior lower surface of the radius. And what does it do? First, its nerve supply is by the median nerve. And what is its action? Is it causes the action of pronation at the level of radio-ulnar joints. Radio-ulnar joints. So that's about the deep muscles. So in all the deep muscles, we had said at the level they are supplied by the median nerve. So which branch of the median nerve, that is also important, that is called as anterior interosseous nerve, simply called as AIN, anterior interosseous nerve, which is a branch from the median nerve. It is supplying, this anterior interosseous nerve will be supplying to all the deep muscles in the anterior compartment, whereas the remaining superficial group will be supplied by the main trunk itself. Okay, so please compare all the muscles in the superficial and the deep are majoritarily supplied by median nerve, except flexor carpi ulnaris, which is supplied by ulnar nerve, and the medial part of flexor digitorum profundus, which is also supplied by ulnar nerve. The remaining all nerves in the anterior compartment of forearm is supplied by the median nerve, directly or indirectly through its branches, but it's supplied by the median nerve. Please remember this conclusion of these muscles. Okay. So previously we had discussed regarding the groups of muscles in the anterior compartment. So what are the superficial group, what are the deep group? Now we will be discussing about what are the blood vessels that are supplying to this group of muscles. So the blood vessels are actually the ulnar artery and the radial artery, which are the terminal branches of brachial artery. Okay, so as we already discussed in the arm that let's imagine this is the lower end of the humerus with its capitulum, trochlea, and this is the radius with its radial tuberosity just below it, and somewhere here is the ulna which will be attaching here. Okay, now the brachial artery will be continuing all along up to the neck of the radius, where they divide laterally into the radial artery and the other as medially the ulnar artery. So this is what I want to say. The brachial artery is dividing into lateral radial artery and medially ulnar artery. So these are the two arteries which will be supplying to the top of the anterior compartment of forearm. So let's discuss the two arteries. First, we will discuss about the ulnar artery in detail, how they are starting, and what are the relations, what are the branches, and the same we will be discussing next to that of radial artery. So let's discuss first about the ulnar artery. Ulnar artery, as we had said, it is actually starting at the level of neck of the radius, right? So starting point from the neck of the radius, it will be starting. So from this point is the neck of the radius. So from this point, the ulnar artery first initially takes a oblique course. Then suddenly it will take all along a vertical course. So during this vertical course, it is running between the superficial compartment and the deep compartment, or superficial group of muscles and the deep group of muscles. So if it is between these two, then which muscle has to be present just deep inside? Just now we had discussed what is the muscle which is coming from the anterior part here. It is the flexor digitorum profundus. So over this flexor digitorum profundus, this ulnar artery is running. So that is about the deep. Then what has to be present on the superficial? All the superficial group of muscles. So what are those superficial group of muscles? Let's see. From this of medial epicondyle, I'm drawing with different colors. First is the Pronator Theories, which is crossing here. Then is the Flexor Carpi Radialis. Then is Palmaris Longus. Then Flexor Carpi Ulnaris. So these muscles will be running over that of the ulnar artery. So simply to say, anteriorly we have the superficial group of muscles, that is Pronator Theories. Second one is Flexor Carpi Radialis. Then Palmaris Longus. Then Flexor Digitorum Profundus. And Flexor Digitorum, sorry, not Flexor Digitorum Profundus, this is Flexor Carpi Ulnaris. Flexor Carpi Ulnaris. So these are the superficial muscles. Sir, what about the Flexor Digitorum Superficialis? Flexor Digitorum Superficialis, I already said it will be considered as actually the intermediate, so it will present lateral to the top of these ulnar artery. So that's why I had not mentioned. If you write as superficial also, because it slightly overlaps it, so it is also a correct one. And what is present on the posterior side is Flexor Digitorum Profundus. This is what the relations of ulnar artery. Simply just remember, there is no rocket science here. It runs between the superficial group of muscles and the deep group of muscles in the anterior compartment. That's it. If superficial muscles, all you know. So those are all covering the anterior side. And what is the deep side? As ulnar artery is running, has to be on the medial side. So what is the medial muscle in the deep side? Flexor Digitorum Profundus. So it has to run in between these two. That's what we had said as anterior and posterior relations. So don't think all these things has to be by heart. If you know about the muscles where to where it is extending, then it is easy to say further relations. And only one logic has to be remembered. Ulnar artery runs between the superficial and the deep group of muscles in the anterior compartment. That's it. Now what are the branches of this ulnar artery? Let's discuss. So this is the ulnar artery which runs oblique course, then it comes as a vertical course. So during this course, first it will give two branches which is called as anterior ulnar recurrent artery and also posterior ulnar recurrent artery. Two arteries are there. Anterior ulnar recurrent artery and the other one is the posterior ulnar recurrent artery. So two arteries are the two branches from these main ulnar artery. One more main branch that is called as common interosseous artery. And this common interosseous artery will be again divided into anterior interosseous artery and also the posterior interosseous artery. See, this is the common interosseous artery, and this common interosseous artery will be dividing as anterior interosseous artery and also the posterior interosseous artery. Next, during this course, it also gives some more branches to the muscles. Those are called as muscular branches. Muscular branches. Okay, these on the medial side and these on the lateral side. First, regarding the orientation. Then, just further below at the level of wrist joint, it will give two branches. One will go to the anterior part of the carpal bones and the other will go to the posterior part of the carpal bones. They are called as anterior carpal branch, anterior carpal branch. The other is posterior carpal branch. So two things are present which will be supplying to the anterior and posterior part of the carpal bones. And finally, the terminal branches. And those terminal branches are two things. One is superficial, the other is deep. So superficial branch, deep branch. The superficial branch will be forming as a superficial palmar arch. Superficial palmar arch. The superficial part will be forming the superficial palmar arch, and the deep one will be joining as a deep palmar arch, which is present in the palm. Okay, so that's about these branches. Once again, I am just summarizing. The first branch is the anterior ulnar recurrent artery. The second one is the posterior ulnar recurrent artery. And another branch is the common interosseous artery, which will dividing as anterior interosseous artery and the posterior interosseous artery. And the names are given because it runs, if it runs anterior to the interosseous membrane, which is present with the radius and ulna, it is called as anterior interosseous artery. And if it runs on the posterior side, it is called as posterior interosseous artery. Okay, let's imagine this is the interosseous membrane. Okay, and this anterior interosseous artery pierces the lower part of the interosseous membrane and then comes on the posterior side. Please remember this sequence because the same we will be discussing under the extensor compartment. Okay, anterior interosseous artery pierces the interosseous membrane to enter on the posterior side. Okay, next, it is also giving some branches to the muscles. They are called as muscular branches, and the carpal branch on the anterior side and the carpal branch on the posterior side. They are called as anterior and the posterior carpal branches, and the terminal branches are the superficial and the deep. So these are all the entire branches of ulnar artery. So these some of the branches are involved in the formation of elbow anastomosis. And how those branches are involved in the elbow anastomosis, we will be discussing after the completion of radial artery, because some of the branches of radial artery are also involving in the formation of this elbow anastomosis. Okay, so first we had discussed where it is starting from the other level of neck of the radius. Second, we had discussed about what is the relations it is present between the superficial and deep. So anteriorly will be the superficial group of muscles and posteriorly will be, as it is present on the medial side, so medial group of the medial muscle is the flexor digitorum profundus, that forms the deep relation. And what are the branches we had discussed now. So that's a summary of the ulnar artery. So once after the completion of ulnar artery, we will be shifting to the lateral artery, that is called as radial artery. So here, the medial part of anterior compartment in the forearm is supplied by the ulnar artery. Then what about the lateral part? And that lateral part is actually supplied by radial artery. So now the discussion is regarding the radial artery and where it starts. This radial artery also starts from the same point, that is at the level of the neck of the radius, where the brachial artery terminates. So from that level of neck of the radius, so somewhere here, it will be descending downwards over the radius, and throughout the course of this radial artery, it is partially overlapped in the initial parts by brachioradialis. So let's imagine this is the brachioradialis muscle, partly overlapped by the brachioradialis muscle only in the initial parts. In the remaining entire course, it has a superficial course only. So that's why anteriorly we can say brachioradialis in the upper part, whereas in the entire part it is superficial course. Superficial course. So once the anterior relations is completed, now coming to the posterior relations. See, ulnar artery is actually running between the superficial group and the deep group, but the radial artery is running over the superficial group which is present on the lateral side. That means the posterior relations are the muscles, superficial group of muscles only which are present on the lateral side. That means Pronator Theories and Flexor Carpi Radialis. These will form the posterior relations. And whereas the lower part is directly resting over the radius bone. And this is the point where we will see the radial pulse. See, for seeing the pulse, the back part has to be a stronger part, the solid organ, and that's why the solid organ here we will select it be as the lower part of the radius where the radial pulse is fed. Okay, that's about these anterior and the posterior relations. Now let's shifting to that of the branches. Now the radial artery, if this is the course of the radial artery, it will give a branch called as a radial recurrent. There is only one recurrent branch, that is the radial recurrent artery. Whereas in ulnar artery we have both anterior ulnar recurrent and posterior ulnar recurrent artery. But here is only one radial recurrent artery. And further during the course it will give small branches to the muscles. So they are called as muscular branches. That's the second group. And just before the termination it will give branches towards the anterior side of the carpal and also the posterior side of the carpal. They are called as the anterior carpal branch and posterior carpal branch, just like the ulnar artery is giving. And in the terminal parts it will be dividing into two divisions. One is the superficial, the other is the deep. Superficial will be joining with superficial palmar arch, which is majoritarily formed by superficial palmar arch, which is majoritarily formed by the ulnar artery, whereas the deep branch will be forming the deep palmar arch, which will be majoritarily formed by radial artery. Okay, so these are the branches of the radial artery. So we had discussed the brachial artery, what are its branches, radial artery, what are its branches, ulnar artery, what are its branches. How these three arteries branches are involved in an anastomosis around the elbow, that is called as the elbow anastomosis. Let's see. Okay. Actually, I'm not drawing anatomical diagrams, but for your convenience, what are the branches on the anterior side and the posterior side, which is present on the lateral part, and anterior side and posterior side of the medial part. I'm separating it. So let's say this is the anterior part and this is the posterior part, and here also anterior part and this is the posterior part. This entire is in lateral, this entire is in medial. Okay, for your convenience I am saying, in the lateral part of the elbow we have anterior, posterior. In the medial part of the elbow we have anterior and the posterior. Now this is the brachial artery and this is the profunda brachii artery, which divides into two things. One is the radial artery, the other is ulnar artery. Okay, now coming to the branches, the main trunk of these brachial artery is giving, one is the superior ulnar collateral artery, which will be going to the posterior part on the medial side, whereas the inferior ulnar collateral artery will be coming to the anterior part of the medial side. So this is called as superior ulnar collateral artery, whereas this is called as inferior ulnar collateral artery. So two things, two arteries, both are coming from the brachial artery itself, the main trunk. Okay. Whereas another artery called as profunda brachii artery. Profunda brachii artery, it is very simple to understand that profunda brachii artery on the anterior side is called as anterior descending artery, and on the posterior side it is called as posterior descending artery. Anterior descending artery, and this is called as posterior descending artery. Both are coming from the branches of profunda brachii artery. Okay, so I'm highlighting the main branches: profunda brachii artery, anterior descending artery, and posterior descending artery. They are one group. Whereas the brachial artery, which is having its branches called as superior ulnar collateral artery and inferior ulnar collateral artery. That's another group. Now, how the lower parts, the radial and ulnar arteries are giving is, the ulnar artery is giving anterior ulnar recurrent and posterior ulnar recurrent. That's what we had discussed in the branches. So anterior ulnar recurrent will be going and anastomosing with on the anterior side of medial elbow joint, and posterior ulnar recurrent will be on the posterior side of the medial side joint. Anterior ulnar recurrent artery, posterior ulnar recurrent artery. So simply to say, on the anterior part, on the medial side of elbow joint, inferior ulnar collateral artery anastomose with anterior ulnar recurrent artery, which is a further branch of ulnar artery. That's the first thing. Second thing, whereas in the medial side only, but on the posterior part, the superior ulnar collateral artery of, which is a branch of brachial artery, gets anastomosed with posterior ulnar recurrent artery, which is a main branch of ulnar artery. Okay, this is what the medial side of the elbow. But what about on the lateral side is, on the lateral side anteriorly there is one branch called as a radial recurrent artery, which is a branch from radial artery itself. Radial artery is giving a branch called as radial recurrent artery. Whereas the ulnar artery is giving another branch called as common interosseous artery, which will be dividing as anterior interosseous artery and also the posterior interosseous artery. Now this posterior interosseous artery is giving one more branch that will get an anastomose with posterior part on the lateral side. That means, simply to say, I'll highlight with this, the radial recurrent artery of radial artery is anastomosing with anterior descending artery, whereas this is called as interosseous recurrent. Interosseous recurrent. So interosseous recurrent artery, which is a branch of posterior interosseous artery, getting anastomosed with posterior descending artery. So this forms an anastomosis around the elbow joint, that's called as elbow anastomosis. Why I am discussing here, why not previously? Because first you have to understand the branches of what is the branches of brachial artery, what are the branches of radial artery, what are the branches of ulnar artery. Then only you can understand which branch is anastomosing to which way, so that you can understand the entire elbow anastomosis. Okay, so that's about this elbow anastomosis. And why it is important, because if there is any obstruction of this brachial artery at the level of elbow joint, just in front of the elbow joint, then this anastomosis will form another pathway through which the blood will be going to the distal parts. For at sometimes the brachial artery before these branches may gets compressed. Brachial artery compression. That may be of any reason, due to humerus fracture or due to any cast tightly applied around this arm. If there is any fracture, any reason, brachial artery is, if it is completely occluded, then distal parts does not have any blood supply. That leads to distal loss of blood supply. If whenever this loss of blood supply is there, then that undergo ischemic necrosis. That means the death of these muscle cells because of this ischemia. Ischemia means less blood supply or no blood supply. From there, that leads to fibrosis of that necrosed part. This fibrosis will causes the flexion at the elbow joint, flexion of the wrist joint, flexion at the wrist joint, the forearm muscles gets fibrosed, then flexion of the wrist joint, extension at the metacarpopharyngeal joints, and again flexion at the interphalangeal joints. And this condition is called as Oakman's ischemic contracture. Okay. Any cause, the brachial artery is compressed, then forearm muscles will get ischemic necrosis, and that necrosed part is replaced by a fibrous tissue, and that fibrous tissue is a contractile part. As fibrous tissue is contractile in nature, so it causes a flexion at the wrist joint, extension at the metacarpopharyngeal joint, and flexion at the interphalangeal joint. Like this condition will be the Oakman's ischemic contracture. Okay, that's about the blood supply and this elbow anastomosis. So to conclude the forearm, front of the forearm with a summary that what are the muscles that we had discussed is, first the muscle, the superficial compartment are the lateralmost is Pronator Theories. Then is the Flexor Carpi Radialis. Then the Palmaris Longus. Then is the Flexor Digitorum Superficialis. And finally Flexor Carpi Ulnaris. So for all these we had discussed about its origins, insertions, what are its nerve supplies and what are its actions. Now coming to deep muscles. The deep muscles we had discussed three things. One is the Flexor Pollicis Longus and Flexor Digitorum Longus, then Pronator Quadratus. Okay. So these are all the structures we had discussed regarding again their origin, insertions, nerve supply and actions. So that's about the summary of the entire flexor compartment of forearm. And what are the arteries that we had discussed in this forearm also, that the brachial artery at the end of the cubital fossa it will divide into two arteries. One is the lateral side, the radial artery, and the medial side is the ulnar artery. This ulnar artery supplies towards the medial side and the lateral artery is supplied towards the lateral sides. And these what are the branches that we have in the ulnar artery, and what are the branches that are involved in the radial artery, and how they are involved in these elbow anastomosis. That's all we had discussed. That's about the summary of entire forearm, the flexor compartment.